This medication is used to help relieve severe ongoing pain. Tramadol belongs to a class of drugs known as opioid analgesics. It works in the brain to change how your body feels and responds to pain. Before you start taking Tramadol Hcl, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take this medication once daily, usually every 24 hours, as directed by your doctor. If you experience nausea, taking this drug with food may help. Do not crush, chew, or dissolve extended-release tablets or capsules, and swallow them whole without crushing or chewing. The dosage of Tramadol Hcl is based on your medical condition and response to treatment. Your doctor may direct you to start at a low dose and gradually increase it to reduce the risk of side effects. Follow your doctor's instructions carefully and do not increase your dose or take the medication more often than prescribed. Before starting Tramadol Hcl, ask your doctor or pharmacist if you should stop or change how you use other opioid medications. Other pain relievers may also be prescribed, so make sure to ask your doctor or pharmacist about using Tramadol Hcl safely with other drugs. It's important not to suddenly stop taking this medication, as it may cause withdrawal symptoms. Your doctor may lower your dose slowly to prevent withdrawal. If you experience any withdrawal symptoms, such as restlessness, anxiety, or sudden changes in behavior, tell your doctor or pharmacist right away. Tramadol Hcl may not work as well if used for a long time, so talk to your doctor if it stops working. While this medication helps many people, it may sometimes cause addiction, especially if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction and tell your doctor if your pain does not improve or gets worse. Side effects of Tramadol Hcl may include nausea, vomiting, constipation, sweating, trouble sleeping, dry mouth, tiredness, lightheadedness, dizziness, drowsiness, or headache. These side effects may decrease over time, but if they persist or worsen, contact your doctor. To prevent constipation, make sure to eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If you experience serious side effects such as interrupted breathing during sleep, mental/mood changes, severe stomach/abdominal pain, difficulty urinating, or signs of adrenal glands not working well, contact your doctor immediately. Seek medical help if you experience fast/irregular heartbeat, severe dizziness, fainting, seizure, or symptoms of serotonin syndrome/toxicity. Tramadol is changed into a strong opioid drug in your body. If you notice slow/shallow breathing, severe drowsiness/difficulty waking up, or confusion, seek medical help right away. If you notice any signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, contact your doctor or pharmacist. Tramadol can be addictive and may cause breathing problems. Your doctor will prescribe the smallest effective dose for the shortest possible time to reduce the risk of addiction. It's important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking Tramadol. If you experience slow/shallow breathing, severe drowsiness, or difficulty waking up, seek medical help immediately. Keep Tramadol in a safe place to prevent misuse, theft, or accidental ingestion. Pregnant women should discuss the risks and benefits of Tramadol with their doctor, as it may slightly increase the risk of birth defects. It's important to note that Tramadol should not be used by children under 12, and certain precautions should be taken for children between 12 and 18, especially after certain surgeries. If you have any concerns about Tramadol, talk to your doctor or pharmacist. Before taking Tramadol Hcl, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to also discuss your medical history with your doctor before using this medication. This includes any brain disorders, breathing problems, kidney disease, liver disease, diabetes, mental/mood disorders, substance use disorder, stomach/intestinal problems, difficulty urinating, gallbladder disease, pancreatitis, or obesity. Tramadol Hcl air may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how this medication affects you. It's also important to limit alcohol consumption and discuss marijuana use with your doctor. This medication may also affect the heart rhythm, causing serious symptoms that require immediate medical attention. Make sure to inform your doctor of any heart problems, family history of heart problems, or any conditions that may affect potassium or magnesium levels in the blood. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications you are taking, including Tramadol Hcl air. Special care should be taken with children and older adults when using this medication, as they may be more sensitive to its effects. Finally, for pregnant or breastfeeding women, it's crucial to discuss the risks and benefits of using Tramadol Hcl air with a doctor. This medication may have harmful effects on an unborn baby or a nursing infant. It's important to be aware of the potential drug interactions with Tramadol Hcl air. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tramadol Hcl air include certain pain medications, naltrexone, and samidorphan. Avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. The risk of serotonin syndrome/toxicity may increase if you are also taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, and certain antidepressants. Other medications can affect the removal of tramadol from your body, which may affect how tramadol works. The risk of serious side effects may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. This medication may also interfere with certain lab tests, so make sure to inform your healthcare providers if you use this drug. If someone has taken too much Tramadol Hcl air and is experiencing severe symptoms like passing out or difficulty breathing, it is important to administer naloxone if available and then call 911. If the person is conscious and not showing any symptoms, it is crucial to contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slow breathing, slow or irregular heartbeat, coma, or seizures. It is important not to share Tramadol Hcl air with others, as it is against the law. This medication has been prescribed specifically for your current condition, and you should not use it for any other condition unless advised to do so by your doctor. If a different condition arises, a different medication may be necessary. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Tramadol Hcl air at room temperature and keep it away from moisture. Be sure to store all medications out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed. Instead, properly discard the product when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.